my name is Jamie. I'll be the student nurse that's working with you today. Can you tell me your name and date of birth? Good, I see that on there. You don't have any allergies, correct? Awesome. So the doctor ordered me to come in and draw some blood so we can run some labs on you. So I'm going to go ahead and do that. Are you having any pain? Good, that's good to hear. So I'm going to start by assessing my site. I don't see any redness, any swelling, or any discharge. That's good. I see I have my biopatch and a Tegaderm dressing, which are both intact. So I'm going to go ahead and start by cleaning off my PosiFlow. I'm going to scrub for 15 seconds. At some facilities, they have you change your PosiFlow every time you draw blood, but for practice purposes, I'm just going to use the PosiFlow that's on here. Okay, 15 seconds has passed, so I'm going to go ahead, attach my pre-prime saline flush. I'm going to go ahead and unclamp. And then we're going to be using the push-pause technique. So first I'm going to push a little bit in, and then I'm going to aspirate for blood, which I see blood in there. So I'm going to go ahead, use push-pause, pushing all 10 milliliters of normal saline in. Everything still feeling okay? Good. Okay. So then we need to draw back our discard. So what we do is we pull back and aspirate 5 milliliters is what our hospital policy is. So 5 milliliters of blood. And since it's a little bit dilute, I'm going to go ahead and pull back a little bit more. Okay, so I have about 6 milliliters of blood. So I'm going to go ahead and clamp and then disconnect. And I'm just going to set this over here so I know that that is not my sample. So then what I'm going to do next is I'm going to alcohol off my port again for 15 seconds. Make sure I use friction. Okay, 15 seconds has passed. So then I'm going to go ahead and I have my 10 milliliter syringe to draw back my blood. And go ahead and attach that. I'm going to unclamp. I'm going to go ahead and pull back my 5 milliliters of blood in my 10 milliliter syringe. Okay, and then just to be safe, I'm going to draw an extra milliliter. So I'll actually have 6 milliliters of blood. Okay, so what I'm going to do is I'm going to clamp and disconnect, and then I'm going to put this right inside of my packaging and just set that there. Now I'm going to alcohol off my PosiFlow again for 15 seconds. Okay, 15 seconds has passed. And then I have my pre-primed saline flush. So I'm going to go ahead and connect that. Then I'm going to unclamp. Then again, using the push-pause technique. And our hospital policy is flushing with 20 milliliters of normal saline. So I'm going to use 2 of my 10 milliliter flushes. alcohol off my port again for 15 seconds. Okay, 15 seconds has passed, so I'm going to connect my final flush. Unclamp, and then use the push pause technique. So then some facilities have you push heparin once you're done drawing blood, but our hospital policy is no heparin. Okay, I'm gonna go ahead and clamp again, disconnect, and I'm gonna alcohol off for 15 seconds. And then they also have some things that are called scrub caps, and those are like little caps with fingers that you can use to scrub the site really well. Okay, 15 seconds has passed, but for practice reasons we just use the alcohol prep pads. So then what I'm going to do is I'm going to document what my site looked like, which is good. My dressing is intact. I'm going to document if I had good blood return, which I did, and that I had drew back 6 milliliters of blood to send to the lab, which that blood I'm going to actually label and transfer it into a little tube, and I'm going to put my initials on it, the date and the time, and then the patient's label, and then we'll send that down for testing. That way if they have questions, they know who to go to. I'm also going to document what I flushed and how much I flushed. So I flushed with 3 10 milliliter normal saline, so I'll document that. And then I'll document that I discarded the 6 milliliters of blood and fluids that I drew back when aspirating. So then I'll make sure to gather all of my garbage and dispose of it in the correct places, and then take my gloves off after my garbage is done. Then I'll perform hand hygiene, and we really want to get that blood down before it starts to coagulate.